Black History and American Heart Month. Welcome to another episode of Slave Food Conversation, where two African-American physicians, Dr. Columbus Batiste, cardiologist, and Dr. Eric Walsh, emergency room physician and doctorate of public health, explore the role of racism as a unique form of stress and the weaponization of food in the creation of health disparities in African-American communities, irrespective of income. They discovered that eating a whole food plant-based diet in urban communities is possible and is the key to eliminating health disparities. The Slave Food team welcomes special guest, Dr. Ramona Snipes, to this week's conversation. Ramona Snipes, MD, is the Assistant Executive Medical Director of Permanente Human Resources for the Southern California Permanente Medical Group, SCPMG, and the Chief Compliance Officer for SCPMG and the Hawaii Permanente Medical Group, HPMG. As the SCPMG's Chief People Officer, she is the Physician Director for Permanente Human Resources and has been given the responsibility for driving strategy and implementation in the areas of physical culture, professional development, leadership development, equity, inclusion, diversity, operational compliance, threat management, and wellness. Dr. Snipes reports directly to the Executive Medical Director and the President of the SCPMG Board of Directors. Dr. Snipes is an alumnus of the historical Black University, Oakwood University in Huntsville, Alabama, from which she graduated with a Bachelor's of Science degree in biochemistry. She went on to graduate from the Loma Linda University School of Medicine and completed an internship in internal medicine at the Berkshire Medical Center in Pittsfield, Massachusetts. She then completed her medical residency training in emergency medicine at the Mount Sinai School of Medicine in New York City. After practicing in New York and then Virginia, including a 5-year single specialty partnership, Ramona and her family joined the SCPMG group in 2008. Dr. Snipes was the Chief of Services for the San Bernardino County Services Area Emergency Department from 2012 to 16. Subsequently, she became the Assistant Area Medical Director of the Hospital-Based Services Line in 2016, overseeing operations in the Department of Medicine, Hospital Medicine, Geriatric Medicine, Palliative medicine in locally contracted skilled nursing facilities and the home care medicine setting. Ramona believes that total health includes physical, financial, mental, and spiritual well-being. Being in a multidisciplinary partnership as part of an integrated system of care matches Dr. Snipes' personal views of culturally responsible, affordable, accessible, whole person care. For this episode, the doctors will address the topic of the state of Black health and explore the causes, cures, and changes that are needed to completely improve medical outcomes. As always, the Slave Food team thanks you for your support. So please continue to spread the word about the Slave Food Project and subscribe to our YouTube channel by clicking the subscription button. Also, share this episode today. Now, let's enjoy this conversation with the doctors.
All right. Thanks so much. Hey, Danette, how are you? Eric, how are you?
Doing good.
Man, it's good. I know Dr. Snipes is having some technical difficulties, some challenges there, too, as well to her health and well-being is probably eliciting a little degree of stress with her right now, not to say the least. So we'll jump into the conversation and bring her on as soon as she's ready to join us. I know she's excited about being here.
Absolutely. Yeah. So it's been a while since you guys have been on and communicating. This isn't the first show of the year, is it? Second show of the year. Okay. And in terms of the Black History Month, we did want to address the state of Black health, especially in 2022. So as it relates to the state of Black health, what are you guys seeing as the top 5 areas of concern for Black health today?
Yeah. Eric, you want to jump in first?
I mean, I think the first and obvious one is always cardiovascular disease. That hasn't changed. In some ways, the pandemic may have actually worsened this. as we're looking at some things that can contribute to cardiovascular disease, which we'll talk about. For me, top 5, number 2 would have to be mental health.
Okay.
This is less tangible. We've seen everyone from Simone Biles to others in the last 12 months really have some serious mental health issues. I saw our good friend Gary Graham chimed in the comments, give him a shout out. And he does great mental health worker in New York. But you know, we're inundated with this. I have to tell you, my own mental health was affected when I saw in New Jersey. So this is in the tri-state area where I live now.
Okay.
The young man who was got into a fight with another young man who looked white, was actually Latino, and the police came and handcuffed him, sat on his back, and put the other kid on the couch. I mean, I had no idea what was going on.
Right.
And immediately did that. Now, the reason I bring that up is that sends shockwaves through our community, in my opinion. And when you see that, you realize, I mean, how do you do that to 2 teenagers when there's 2 boys fighting like boys fight all the time? Our mental health, because of things like this, is always going to be impacted. We talk a lot about stress and those kinds of stresses. Because you say, what if that was my son?
Right.
So I think mental health is another big one. Clearly, we still have issues around cancer. Diabetes are should jump above cancer in terms of numbers of affected. And then, of course, there's hypertension as one of the ones that kind of stand alone that impacts some other things. But I don't know, Dr. Batiste.
Yeah, no, I mean, you say that.
So if you rank his 5, would they be in the same order, or would you change the order around a little bit?
No, I mean, I think I do. I mean, here's the thing. So when you're looking at chronic disease and top killers, there's a unique interplay. So when we're dealing with mental health, we understand, and we bring this out on multiple instances of how the mindset really plays a role in the development of chronic disease. So one could argue in theory that mental health really trumps everything, because it's driving the decisions for addiction. It's driving the decisions for poor behaviors and habits that lead to cardiovascular events, high blood pressure, diabetes, and even cancer. And so as a whole, if we look at root cause analysis, it's all going to stem back to our mental health, which then ties to other things we brought forth in the past here as well. So I do actually agree. And I guess after I made that statement, I would probably have to say that I would rank mental health first. It's hard to say above the heart, man. This is what I do.
Well, while you're doing your list, I want to invite those who are able to chime in. Like, please rank your top 5 as it relates to the Black health crises and what you think they are. But okay, so Columbus, you're going with mental health first, and then you're going to go with heart disease second.
I'm going to go with heart disease second, and
okay.
We're going to cross my fingers, right? So I'm going to decrease I'm going to hope my mental stress is good. Dr. Snipes, can you hear us? Not quite yet. We're
getting. She can hear her. We can't hear her now.
We're getting closer. But yeah, so I'm putting up mental health. I'm putting up cardiovascular disease, and really, to be honest with you, hypertension is really it's included inside that. So when we look at that, I'm going to include stroke inside that too, as well as a top killer. And then right below that, I'm putting diabetes or cancer and diabetes right there hand to hand. So it's going to be cancer and diabetes.
Okay. One of the things I forgot to mention, instead of saying hypertension, honestly, what I wanted to say is violence. Because we are watching epidemics of violence in our cities. One of our former guests, the current mayor of New York, Eric Adams, actually addressed this. I don't know if you got a chance to see that the press conference he did on this. But we're across the country. We're seeing this, and okay, so obviously we focus a lot on police violence, but the violence inside of our communities is staggering and does go back to mental health again. I honestly believe, I learned this way back in the days reading Jawanza Kunjufu books back when I was in high school and at Oakwood, that self-hatred is a powerful driver of the homicidal behavior we see sometimes. Okay. And it goes deep. It goes into the colorism to some extent, but really just goes into the idea that if society doesn't value us, Sometimes we don't value each other. We're put into hostile environments of poverty, poor education systems, even poor nutrition, we know, impacts behavior. I would throw that one in there because the ripple effect of one murder, and I've had multiple family members murdered, the ripple effect of one murder really does impact a lot of people in terms of post-traumatic stress and many other things. So I would have to, the fifth thing I'd put on that list at least is violence. But Columbus makes an excellent point. Mental health undergirds everything.
Yeah.
It really does. How disease manifests has a lot to do with our mental health.
So where you guys are kind of just putting that under the section of stress, are you just kind of calling it stress, loss of life? Would be that violence category, unnecessary loss of life per se?
I would use the word violence because it's not just loss of, it's an intentional loss of life.
Okay.
So you could throw in there suicide, homicide. Someone put in the chat about the Miss Alabama who committed suicide recently. That broke my heart. I had never heard of her, never seen her before.
Yeah, I think that was North Carolina. Miss Alabama did pass away, but they didn't do that one.
It was a suicide recently.
Yeah.
That really broke my heart.
Yeah.
Because it was like she's just a beautiful young lady.
Right.
And we see that. I mean, I had a 13-year-old cousin who committed suicide. I mean, again, it goes back to violence, this intentional harm, and in a sense, it's self-harm because even if it's against your brother, that looks like you, kind of still a form of self-harm. So I don't know. That's one of the tougher ones to actually deal with because there are social determinants of health that need to be addressed for us to be able to fix some of that stuff.
Yeah. I mean, that's the whole thing is that there's just this sense of hopelessness that pervades our society right now. And, not to override the show, the state of Black health, but I think we have to look at the mental well-being that transcends our communities and other communities at large. And so when we're looking at that, as you mentioned, the mental health is a major issue, just the stress. I mean, from a standpoint of forget those who are struggling financially, we understand the country as a whole has been hit by this burden of empathy fatigue, of just the constancy of the COVID, the surge, and healthcare providers are at their wits' ends. And so we're seeing individuals in the healthcare field who are committing suicide and are leaving the medical field because of empathy fatigue. And so stress is at an all-time high, and it's leading, as we know, to many of the ailments that are there. Didn't think I was going to go into psychology or psychiatry when I went into training, decided to do cardiology, but I'll tell you, it's a major part of my practice every single day.
So if you look at our community as a whole, previously, and this may just have not been accurate, but, we would just say, well, at least we're not killing ourselves. Like we were not leading in that area in terms of, suicides. And it seems like, those numbers have started to increase, or maybe we're just hearing more about it now. But, previously, we would say, okay, well, we're not typically serial killers, and we don't typically usually, kill, commit suicide, but you're seeing those numbers jumping up a lot. So are you kind of saying it's more COVID? Is it just prolonged stress? Is it just the prolonged situations that we've been dealing with where like maybe the younger generation or people don't have the same level of resilience that we feel like we've had in the past?
I think some of these trends were actually going up before COVID hit.
Okay.
Some of the stuff we're dealing with actually hit us before COVID. And I think COVID has accelerated a lot of things. Obviously, it accelerated deaths among us, but it's definitely only worsened mental health issues. And to some extent, some of the violence and some of the other things that we're seeing, I think COVID has only made worse.
Okay.
So there's some underlying things that have to be fixed. When we talk about these things, I think we as a people have to rally around for solutions. Right. I don't think you can fix it waiting for somebody else to come in and fix some of these things. And that's the challenge. Those are the social determinants of health. How do we assure that education, jobs, relationships, all of those things are exist in our communities? And thinking that the government or somebody else is going to do it, obviously they have a role to play. But there's a collective movement that needs to take place if we're going to reverse some of these things.
Okay.
I'm going to jump in a bit. And what I'll say, though, too, as well as it relates to the mental health crises and really the top killers and issues in the Black community is we're dealing still with the issue of access. We're still dealing with the issue of whether or not we're accepting, whether it's a diagnosis of mental health or whether or not it's other diagnoses too as well, meaning awareness. So we understand that individuals are less likely to be treated across the board, for various avenues. They may seek that more African Americans and people of African descent tend to be uninsured, and so receive their care inside emergency rooms, like where Dr. Snipes practice. She's unfortunately unable to join us right now due to technical issues. And Eric, Dr. Walsh, where you practice in urgent cares. So when we see minorities seek their care there, are they less likely to make the bonds and connections to really feel comfortable bringing out issues of mental health issues and or have the appropriate screening for things like cardiovascular disease, diabetes, high blood pressure, and cancers if you're predominantly receiving your care out of emergency rooms and urgent cares? And so I think the issue is, why is that the case? Why is that the case? Is it because of insurance? Is it because of the ability to go to an appointment when my office hours are from 8:30 to 5 when they're working? And we know more individuals of people of color are frontline workers. And so it's harder to get off and take time from work to do these things. And so it becomes a systems issue. It's not just an individual, our system is broken. As healthcare providers, if I'm delivering care when you're working and you can't come see me, I can't blame you, right? I can't blame you. We have to shift and be able to adjust and meet people where they're at across the board. And I think that's important from our perspective as healthcare providers.
Yeah. Kim Robinson said we need to address healthy eating, nutrition above all. As the mayor, Eric Adams, has said, the brain is the body, so we need to address what we put in the body. We also have comments in terms of the ranking of, what those top 5 issues are. We're seeing a consistent mental health. We're seeing, hypertension, diabetes, cancer. Those are some of the items that are popping up as the top items and concern. So I think we've covered mental health at pretty, at least a little bit, at least scratch the surface. And it sounds like the solution from a mental health standpoint is that we need to collectively work together to address some of these issues in the, that we're experiencing in the community, whether that be at home, at school, in the churches, through community centers, things of that nature. Is that pretty accurate summary of what you guys are stating?
Yes, and I think what's critical. We mentioned food, we've mentioned drugs and alcohol. We talked about a lot of things. Nothing exists in a vacuum, right? So whatever's happening happens as all of these different things work together, kind of in concert to make them happen. So you have to begin to break the pieces back out. So it's not enough. It'd be great if we could feed everybody good food, but if they still didn't have jobs and they had poor schools, you'd still have poor health outcomes. I would agree that, especially based on what we talk about here on Slave Food, that is at the top of our priority. I mean, we think people need to do that, but we have to recognize that there are bigger issues that are harder for the individual to control that impact health as well.
For sure.
Yes. And I think, Ramona, I think you're on mute. If you, let's see if we can get you unmuted. We might be able to hear you. Technology. She has something important to say. Technology is not allowing her to say it. This is just.
I think I hear.
There we go.
Oh, yes.
Awesome.
Let me tell you, my oxytocin levels just went through the roof now. I'm feeling it. Yes, ma'am. I'm feeling it. Welcome.
Well, Ramona,
fingers crossed this works.
After reading your bio, there's a statement in the chat, and it says health equity needs to be in the DNA of all healthcare organizations, which includes supporting a better food system. We can also lean into our elected officials to promote the Farm System Reform Act, sponsored by Cory Booker, as well as other interactives which help Black farmers in communities of color. But I know that you being extensively with Kaiser Permanente and being able to work your way through various areas at Permanente, what do you think are some of the solutions to fighting some of these health equities?
And one sec before you jump in,
right.
Dr. Snipes. I want to acknowledge Dr. Snipes, because I think when we look at Black history and we're looking at African American history, we're looking at Heart Health Month, I have to acknowledge what she's overcome, right? As a woman, as a person of color, in achieving the level that she's achieved within that organization. Kaiser Permanente is one of the largest healthcare delivery systems across the United States. And she's achieved a level in the executive leadership there that has to be applauded. And her ability to impact change is profound. So we're honored to have you on tonight. I'm glad that the technology, worked out, because we have to hear what you have to say. Sorry for interrupting, but I just wanted to kind of throw that in there for sure.
First of all, I'm using 2 devices. Am I echoing?
No, you're great.
Fine.
Okay, good, because I'm hearing myself in my ear. I've got my phone on the desk. I've got my computer in front of me. We're going to make it work today.
Problem solving 101. There you go.
All right, now.
Absolutely. So I'm going to try to remember what the question was.
Yes. So it's just with regard to healthcare organizations and what is their responsibilities as it relates to, kind of just leveling out the inequities, for the Black community.
Yeah, absolutely. So I think what I like to hearken to, what I like to tether to, most recently is information that I read that resonated with me from Dr. Livingston from Harvard.
Okay.
And he talks about understanding the problem first and foremost, getting real clear on what the issue is. I think for healthcare equity, sometimes we don't have clarity around the issue. Oftentimes I'm in rooms with other healthcare workers, and they'll say things such as, we just need to educate the community, and lose the impact of systemic racism on an entire group of people. And so I think it's important first and foremost to be clear about the problem we're trying to solve, and really understand the root cause of that. Have empathy around it, and then begin to come up with systemic structures and processes to address those issues. For healthcare in particular, and I've had the opportunity to work with both of the gentlemen here, we really need to understand, I think this is something I've heard from Columbus, our DNA is not inferior. There are other issues at play, and we need to address all of those issues. We need to be thinking about the social determinants of care and health, understanding that true justice should not, or in a justice system, our longevity should not be dictated by the color of our skin and the zip code we live in, and understand our ownership and accountability for addressing that.
Absolutely. Absolutely. So before you connected, we were asking in top 5 as it relates to, what you see as the health challenges in the Black community. Are you able to kind of weigh in on what your top 5 would be?
My top 5. Where were we? What were we talking about before? I'm a big proponent of the social determinants of health conversation.
Yes, no, in terms of the Black community and our top health, challenges that you see.
The reason I asked it that way is, were you thinking about nutrition and the social determinants of health, financial equity, or were you talking about it from the perspective of disease? That's why I asked it that way.
We were looking at disease.
Okay.
But you raise a good point. I mean, you can't separate that from financial issues and other issues.
No.
We were looking at disease.
Absolutely. Well, I'm an emergency physician, right? When I see people, they've already suffered the ravages of their poor health, and the health choices that have been made available to them and they've made themselves. I see complications of diabetes. I see complications of hypertension, vascular disease. I see complications of obesity, chronic disease associated with those.
Okay. Thank you.
Yeah, that's what I would add.
That's huge. And so, Dr. Snipes, I mean, from your perspective, put back on your hat as a clinician, right? Take off your administrative hat. And so you're in the throes as an ER doc. In terms of access, one of the things we were talking about before you joined in was that one of the access problems that we see is the fact that people of color oftentimes seek care out of emergency rooms and urgent care centers, which obviously plays a role in perhaps the inability for them to receive mental health care, perhaps the inability for them to receive the appropriate preventative care and screening that they need. And so I don't know if you want to speak to that at all, and some of the work that may be in the throes nationally to kind of to thwart that.
Yeah, so it is something I've recognized in the past 20 years of practicing emergency medicine. Oftentimes the patients who come to me are underinsured. They have uncontrolled chronic illnesses and basically a lack of information about their own health. And oftentimes, for those who are insured, they don't necessarily have a job that supports them being able to access primary care during the routine hours that primary care is open. I often find myself educating patients, using motivation to try to talk them through what needs to be done and how to find the drive to do it. I even remember calling Dr. Batiste and saying, what videos do you tell your patients to watch so they can begin the journey along nutrition? I spend a lot of time educating patients. I had one come in once who had a sprained ankle. That's what he thought it was. And I looked at his ankle and I said, this is a complication of diabetes. This is not a sprain. So that's a struggle for me, the actual physical access to healthcare and how a population of people are underserved and access acute episodic care when what they need is chronic long-term longitudinal care.
Right.
And then there's another access divide that we have to think about in this day and age. It's the digital divide.
Yes.
As we become more and more virtual in healthcare delivery, for those who don't have good Wi-Fi, today that's me, and for those who don't have devices that they can use to access the virtual healthcare offerings, we now see that there's a new access divide that persons of color are challenged with as healthcare changes and is at this inflection point, of virtual healthcare.
Wow. Now that's a great point, because it's, you forget about it, but that digital divide impacts people in terms of the educational system, and we saw it during the pandemic of the haves and the have-nots as it relates to it, and across the board as a whole. So yeah,
absolutely.
No.
I think a lot of people who are disadvantaged from digital healthcare access have noticed the nature in which their children were affected during the shutdown. My own children, who have excellent access to health, to education, to private school education, in fact, really lost something in that initial year of moving to virtual care. The delivery wasn't the same. My little one, who was just learning to read, lost some ground, and we had to supplement. And I think about those parents who struggled to make up the difference.
Yeah.
And the same thing in healthcare.
Yeah, absolutely. Absolutely. There's so many divides. I mean, we look at social determinants of health, and you talk about predictors of health and well-being. You look at education as a predictor, your zip code as a predictor, your wealth as a predictor, right? And so wealth, we always think of wealth. I shouldn't say we always, many think of wealth in terms of their job and their annual income. But wealth is greater than that. It's your home values. It's your trust, the things that you can pass along generationally, and the suffering. And that's one of the things that I know I've tried to bring out in various lectures, is the fact that this didn't just happen right now. This has been a snowball that's been building up, that goes back really over the past century, and greater than that, obviously, from redlining to the lack of GI bills for education and for home loans, and all these variables that are there, then to being shut out of decision making. And as we comment frequently in terms of Whitehall study, that if you're not in the power of making decisions, your burden of cardiovascular disease and ailments goes up astronomically when you lose that control, a form of loss of control that's there in terms of chronic stress upon you. So there's so many things that you bring up.
One of the things that always amazes me, especially during the seasons of elections in this country, is how much conversation is around health insurance. So we say, we need universal health care. We need, and I think what Dr. Snipes talking about is exactly right. We have to have good access. People have to be able to get to care. But as we also, as you also mentioned, the social determinants begin to step back and say, what kind of food environment do these families live in, right? So, I've lived in neighborhoods where literally, if you wanted to walk and get food, you were going to walk to a corner store that didn't have fruits and vegetables, but it had every type of candy and chip known to man, every sugar sweetened beverage known to man, and of course, a strong cadre of alcoholic beverages. And so if you aren't someone, I have people work for me who Uber to work. So so I have to ask them, how do you get groceries and stuff? Because obviously you don't want to spend money to go get groceries. You're gonna try and walk to what's closest to you.
Absolutely.
There's a whole lot to be said about, and we talk about this a lot in Slave Food, a lot to be said about how America created the food system that it has. So that if you live in certain neighborhoods, you have Whole Foods and you have the money to go into Whole Foods and buy food that you feel is much less likely to have chemicals, pesticides, is organic, much more rich array of fruits and vegetables than someone else who, ironically, is often paying just as much money for the food because there's no competition in the neighborhoods, or the government is subsidizing the purchase of the foods, and for a long while wouldn't allow you to buy the best foods. So when I listen to the politicians, it gets me, because they want better health care, but they never speak to the desire for better health. Eric Adams seems to be kind of the exception in that regard, but that's where we have to get to for Black people in America. We've got to get to, okay, let's move past the healthcare system to health. The healthcare system has to be good, though. It has to be there if you get in a car accident, or if you have some bad disease does happen to you. But a lot of what we're battling if we went upstream, we actually could stop from happening. And I just don't see the political drive to try and fix some of these things, because millions of our tax dollars every year go to subsidize the people who create these products and put them into our neighborhoods. So that's a challenge, and that's one of the fights of equity that's going to have to happen, to me, in the next 5 to 10 years if we're really going to turn things around for Black America.
Yeah, absolutely.
Go ahead. I was going to just say, since we're giving out flowers to Mayor Eric Adams, I'm going to continue the rose piece there. And one of the things that he's done is collaborating with one of the hospitals there to really transform the nutrition. Because when you talk about nutrition, yes, it's indeed, there's issues that are pervasive inside the communities in which we live. But then you go to the hospitals where many people seek care, right? And many people of color seek care at hospitals that have a lower quality rating, right? And these hospitals also have in them foods that are deleterious to their body, fast food restaurants inside of the hospitals. They come out of having bypass surgery and receive a hamburger that they can receive if they want, or their family brings them in a greasy bag of whatever it may be. And so one of the things that Mayor Adams has done is really trying to work with a specific hospital system there in New York in order to transform and to have fresh fruits and vegetables and healthier foods. And I Dr. Snipes, you're in administration. You can probably speak to some of the challenges and some of the successes that many institutions maybe are undertaking, as I believe many want to do the right thing, right? And so I believe that there's goodwill, but what's standing in the way with us really crossing that bridge and really doing what we need to as healthcare providers and systems?
Yeah, it's so important we put our money where our mouth is. So I trained at a hospital in New York City, and I won't mention the name since we're talking about Mayor Adams. And they got rid of the cafeteria and put in a McDonald's because it was cheaper. It's easier for the hospital to not have to maintain the cafeteria, the things they had to purchase, and the staff that worked there.
Okay, so
and I noticed
the whole thing, right?
I noticed all the doctors stopped eating at the hospital, and we started to bring our food or go to the nearby restaurants. But the patients who were there and their families who were visiting, they had to go to the McDonald's.
Wow.
I don't know if it's still like that, but it was like that my last 3 years of training.
Wow.
Meanwhile, we're in a hospital system now where they've removed sugar from the cafeteria, where they do sous vide cooking and have removed the greasy fryers, and is really thinking about the long-term health of their members.
Right.
And part of the reason of that is our tradition, but it's also economic as well. Our members come and stay. We invest in the healthcare, and we are prepaid in terms of membership.
Right.
So we are as much invested in our members being well
Right.
as are our members.
Right. So the way that you guys are incentivized is to keep them healthy versus keeping them sick.
And all of healthcare should be incentivized towards health.
Right.
California leads in that, actually, having multiple systems like Kaiser being the giant of all of them.
Mm-hmm.
But and this is something I just spoke to someone in Massachusetts who does the kind of work of population health management for healthcare systems, and she was like, "Listen, what you see on the West Coast is coming to New England because it's the only sustainable way forward long term. I mean, you have to lower costs and change the motive and incentive from." Put as many people in the hospital as possible because that's how we make the most money, to keep the people out of the hospital. And as long as that can be done and regulated well, because that's going to make us the best profit, and obviously would be better for society.
We have to tie our incentives to our goals.
Absolutely.
Absolutely.
In other words,
oh, go ahead.
I was going to say, in other words, Eric, we have to put resources where our value is. All right.
Exactly.
So if we really truly value health, then our resources go where we value, right? Inside the nutrition, inside those things there. And it's not good enough for us to call preventative services screenings, colonoscopies, and mammograms, although they have their place and their purpose. But really, preventative services is at the grassroots level, at the beginning, the base, in terms of lifestyle, is a core component.
And so my question is, with regard to technology and how we've had so many technological advances, are you seeing them in any way benefiting the healthcare system in any of those 5 areas that we discussed in terms of like heart health, mental health, all of those things? Are you seeing anything that is like driving the numbers down versus having them being maintained?
The most easily amenable, I'd say, in this new virtual healthcare delivery system is mental health.
Okay.
Those things that don't require having a clinician and a patient in the same room.
Okay.
And so the access should be better. We are finding, though, that people are accessing healthcare, mental health care, even more now than they did before. The isolation, the instability of the pandemic, the grief from the loss, and the anxiety from the uncertainty and watching the nighttime news. The demand has gone up and the access has remained almost the same. So the platform exists, but the access is still a challenge.
Yeah.
Okay.
Yeah. And I'll join in there and say, one of the things that I'm proud of is my organization's ability to rally behind the efforts to deliver lifestyle in the form of what's called cardiac rehabilitation. Right. Okay. So the rehabilitation, it really encompasses not only mental health, it encompasses eating healthfully, it encompasses stress reduction, it encompasses moving more than you're sitting. Right. I mean, such phenomenal data has come out of simple forms. Just 10-minute increments of moving can really change the direction of your life in terms of longevity. That just is not even about even exercise. But there was a recent study that came out just this past week that elderly women who just increased their moving around, vacuuming, sweeping, doing different things, that all of a sudden they live longer. And so they did a comparative analysis where using a pedometer, just a little marker of their steps, and found a distinct difference in that. So technology can be your friend. Technology can be your aid to give you information, that feedback that you need. Because remember, health is not a monolith. It's not something that's specific to just solely food. And it sounds like heresy coming from me, because you all know I preach food, and more food all the time. But I'm going to tell you, it encompasses also how your mindset is. It encompasses how you move. It encompasses something that people skip out on. Now, I'm going to put us all on blast right here, right now. I'm going to start first with, I'm going to put guess, Dr. Snipes, you're last.
Okay, thank you.
Danette, how many hours of sleep did you get last night?
4? I don't know.
4, 6, or 8?
6.
Okay.
Maybe.
Dr. Walsh, how many hours of sleep did you get last night?
I got 7 last night.
Okay. All right.
which is not bad for me. 7 is all I need. I get 7. I'm good for the
That's
day.
good. You're around. That's where you need to be, Dr. Snipes.
I got 7.
All right. So listen,
How
we
about
have,
you? How about you?
Yeah. How
it
many did you get, Dr.
it was,
Batiste?
it was a little bit of a struggle for me last night. I probably was around 6. Right. I had every
That's because
good
you kept me
intent.
up, y'all, and I'll just
Yeah.
leave it at that.
Every,
Okay.
every good intent on trying to get sleep, but that's where the problem kind of lies in. But what I'm saying is these are all the pillars of health, and everything builds towards it. And so, yeah, back to the original question. Yes, technology can help, and that's where I've seen my organization I work with really rally behind a virtual cardiac rehabilitation to help members, and it's transformed lives.
And you're
Well,
also
technology
seeing,
is a platform, right? It's only as good as what you deliver on it.
Absolutely.
Exactly.
Right. And you're also just finding in terms of just conversations and just information. I mean, I think there's an information overload. Like you can hear, you can learn about just about anything, right? You can just Google it or YouTube or, Clubhouse. I mean, there's just so many different ways, podcasts, like you're getting information. It's not just coming from books and things of that nature. But if we're not really seeing that it's impacting us for good, it makes you wonder in terms of like, is it information overload? Are people getting so much information that now they don't pay attention to what they're hearing anymore?
Well,
And I find sometimes it's challenging also because you're not sure which information is accurate.
It's accurate, right?
You can get conflicting information
Mhm.
from the internet. Wine is good. Wine
Yes.
is not good.
Right.
When is it good?
no,
Right.
you're absolutely right, and I think that's where I think it boils down to having a trusted source.
Yes.
And this kind of dovetails back into the beginning of our conversation to why do these health disparities persist? We're the top killers? And one of the things that is pervasive inside of communities of color is a level of mistrust inside the healthcare system. That is not something that's a facade. It's not something that's made up. It's something that has been generationally impacting family members and others, and impacting areas of implicit bias. So when
And let's be
individuals,
honest.
I mean, when all that stuff happens, when you get implicit bias, you have areas where a person is misleading you or they're not giving you the full truth. It breaks that trust bond, which is so important between healthcare providers and their patients.
Yeah.
And
So what I was going to say is it's not undeserved.
Exactly. It's not undeserved. It's not undeserved. So what do we do about that?
Well, first and foremost, it's advocacy. In an ideal system, that would be offered, right? That those elements that are necessary for trust. But when it's not there, self-advocacy, advocacy for your friends, families, loved ones, that's what's necessary. And then seeking out, again, that information so that you have that trusted source. Sometimes I function as that for my family. And I like to think that all people are my family, but I can't be available for everyone.
Right.
So we do it for each other, for the ones that we know.
Yeah.
And Eric, what do you think?
If I was to get into, really look at some of these things, something we had a show recently where we had on pastors of 2 large churches in Atlanta. I think there's got to be a way, when we're talking about advocacy, there's got to be a way to create systems where advocacy can happen.
Yes.
You know what I mean? That's one of the things that we could do. I mean, that those resources do exist. But there's also, when you're talking about information and conflicting information, it's difficult. How do we empower people to get the right information? And we've seen recently that there's a war around information. You can get two completely different stories about the same thing. And if you're not in the know kind of scientifically, you can pick the wrong side. So we have a lot of work to do around empowering our people and supporting our people. And what Ramona said is really deep. She said, everyone's my family, but I can't necessarily be there for everyone. That's absolutely true. But could our houses of faith come up with systems where we could support people and have advocacy so that people could go to the doctor, even if we can't go with them? There's a way that they can come back. There's a time, an evening with the doctor, something where you come back and you can ask these questions and get clarification. I get these calls all the time. People call me and ask me, hey, my relative is going through this. What do you think? And sometimes it's not my specialty. So, I'm like,
Sure.
I'm not a neurosurgeon, so I can't tell you what to do, yay or nay. But I think we could create that kind of a network. What is in our power is to support each other. What is in our power is to elevate truth and our health message. That's something that we can do to benefit our people, regardless of where they are, regardless of their circumstance. But this is what we do is a small part of that. But how do we grow that? How do we make that bigger? Is I think something we're gonna have to look at going forward.
And that brings me to the question around, just Black medical students and the numbers, right? Like you're looking at how, like in terms of like there's, I think and I don't know the statistics, but where, the number of Black students graduating from medical school is almost the same as it was in the 60s?
78.
What was it? I'm sorry.
1978. Yeah.
The 70, like those numbers where you're seeing like where our people aren't going into the medical field. And so, what are your thoughts around that?
Well, let me jump in real quick to what Eric was saying before. And I think that one of the things is that we do have a rich history in exactly what you were talking about in terms of coming together collectively as a church. And so I was just recently kind of researching and looking through things of like the Free African Society with Richard Allen and Absalom Jones and starting where what they did was because of the fact that the free slaves were not able to kind of get the care they needed, they came together to help support and provide services. And not only for kids, the orphans that were there, but for those with medical ailments during one of the outbreaks and various things. And so the platform was there in terms of it historically and so forth. And so you're absolutely right. We have to use not only our resources of money, right, to give back, but our time and our energy and our knowledge, which is what we're trying to do, what Healthy Heart Nation is trying to do, many organizations are trying to do, but we have to be more intentional with those efforts to give people the support that they need to understand. But, sorry, Jeanette, to interject that with the question about what's keeping our Black, our persons of color out of medicine. And that's a loaded question.
I thought I saw something recently. You guys correct me if I'm wrong. I thought I saw something recently that there was an increase in the number of Black medical students.
So I know within the School of Medicine, the Bernard Tyson School of Medicine, they recently had an incoming class that had one of the highest numbers of, I believe, African-American men. And when you look at African-American men entering into medicine, those numbers and statistics, I believe through 2020 were similar to 1978.
And I think that number was 5. Like if 5%. I remember correctly, it was like, yeah. So in terms 5%. Of that being, it's still nothing to, to celebrate at this point. So the question does go back to why.
Yeah.
Is it barriers?
I refer to Black male physicians as unicorns. Very rare. Nowadays, hard to find. Yeah. And I've noticed that when I have, in particular, concordant patients, they're so excited to talk about their Black male physician.
Yeah.
There's something in that connectedness that makes them feel seen and valued and really escalates the experience for them so that they're more trusting and able to have access to sources that they believe care about them and think through their healthcare goals together.
Right.
But that issue of bench strength and pipeline, that's a big deal. I appreciate that at the Bernard Tyson School of Medicine, they built it into the charter to have underrepresented individuals in medicine present in order for the class to the school to be open.
Right.
So when we think about the fact that the class size is only 50,
it's
small.
Yeah.
It's really small.
Yeah, I'm looking at an article from Black Enterprise that says that Black students are enrolling at medical schools at record levels. So there is some increase somewhere in the number going into medical school, and I want to say that because I think part of that is the work that's happening at HBCUs, and the fact that there are many more of our young people getting into colleges and universities all over the country to be able to get into the medical schools. Obviously, it's not enough. We are 12, 13% of the population, so unless we at least are 12, 13% of the people graduating from medical school. It definitely is not enough. But I'm telling you, I see patients sometimes and they thank me. They stop me and say, "I'm so glad to see you, a Black doctor." They actually are happy to see. And what I do, especially for young people, teenagers, I make a point to say, "Listen, we need you. Study hard. We need you. If you have any desire to go into medicine, please do. If I could do it, you can do it. Study hard and go in." And I've seen some teenagers come out with big smiles on their face for being affirmed by a physician, a Black physician, to go into medicine.
No, that's huge. That's extremely huge. I remember the few instances of encountering an African American physician that affirmed me and acknowledged me was so important in my growth and matriculation. But going back a moment or so, when you asked the question, what's the major issue why there aren't more Black physicians, we can go back to the Flexner report. So Flexner came out in the early 20th century when they went to reform and transform all of the medical schools. But in that moment, what they did was they closed down the majority of medical schools with the exception of Howard and Meharry. And what they said was that
a majority of Black medical
schools, thank you. And making a statement that the purpose of the Black person was to kind of take care, prevent like infections receiving into the Caucasian population and to be subservient, right? And
janitors and things of that nature.
You fast forward that the only other Black medical school that really kind of came up was Charles Drew medical school that came up separate from that. So you add that to the fact that when we still alluded to educational determinants of health, and that education is predictive of your wealth and predictive of events. We still see that of African Americans, it's roughly around 20 to 22% graduate from a college degree. And even a smaller percent go on, I believe 8 for a postgraduate level. And the majority of those are women. So it's no surprise the fact there is a paucity, as Mona said, it's a unicorn to see a Black male physician, and we have to sit there and recognize that. I'm saying, when I say we, I mean myself, because I know I know the greatness of Dr. Walsh. I know many other people. I know Dr. Snipes. I know people. So my kids grow up like, what's the big deal?
Right.
I know a lot of Black doctors. They're a dime a dozen, right? Because they have a skewed perspective. Just like everything I see is heart disease, because that's all I see, right? And so I think there's a lot of work to be done, and that work begins in kindergarten, in preschool. I think that work begins there, same as it relates to like health, learning about nutrition and exercise and all the aspects. It begins there through these STEM projects and us supporting them.
Right.
I'm going to throw in one more of our schools, Morehouse.
Yes.
That also has a goal of graduating more Black physicians.
Absolutely.
Yeah, and go ahead. Well, just not with healthcare. I mean, the whole point of it is that you really can't, you can't be what you can't see, right? And so that's like why like Healthy Heart Nation is really focusing on making sure that just on a personal level, just from a relationship standpoint, that we are talking to people and showing them that there are Black professionals out there in healthcare and business and justice and education, all of those types of things where it is something that can be accomplished because it has been accomplished, right? So people just see athletes and, the reality TV stars. They need to just start to see practical people like us doing things for the community, for the sake of the community, and letting them know that they have the ability to do the same.
I want to mention something from a couple of comments back. And I learned about this just before I went to medical school. I think it was the National Science Foundation found that you're more likely to finish college, which is obviously a prerequisite for med school, in the science, technology, engineering, and math fields for those who go to historically Black colleges and universities. We're graduating more STEM students who complete the full matriculation on a rate basis than our majority institutions, I want to say, our PWIs.
Absolutely.
That's deep. I want to shout out Al Evans, our good friend, who just made that comment. Wouldn't it be a beautiful thing? I mean, if Columbus and I talk a lot about what we would do if we came into Tyler Perry money. I tell you, one of the things I would definitely do for Oprah money, it would be to start at least one other Black medical school, probably affiliated with Oakwood if I could figure that out. But I would love to do that. Even if it was a 50, 60 class school, it would be powerful and teach them with the undergirding of lifestyle medicine, preventive medicine, all those different things, because that is really an important part of what needs to happen. And what Ramona just said is really critical. I mean, we all went to an HBCU, and it made a huge difference for me. Honestly, I don't know I'd be where I am today had I gone somewhere else. I don't know that I would have been. And so that opportunity, in terms of medical schools, would actually be quite beautiful. But I have to take my hat off to Meharry, Morehouse, Howard, and Charles Drew for the work that they do, because that's a big reason that Black Enterprise article could say there's an increase in Black medical students, because some of those schools expand their classes and so forth. So we appreciate the work that they do for sure.
Okay, so we've got 3 minutes left. Each of you guys will give you a minute to just your last parting words as it relates to the state of Black health. And I'll start with you, Dr. Snipes.
Well, thank you. I just want to say that healthcare is hugely important. I think that comment was made here, and access to good healthcare with incentives around keeping people healthy. But we understand that healthcare is only 15% of the social determinants of health, the things that determine how well you live and how long you live. So there are additional pieces of that work that needs to be done, both in society and in government, in justice and in finance, to ensure that the Black community remains healthy and closes the gap between persons of color and others who are more represented in society.
Fantastic. Dr. Walsh?
I'm going to go back to one of the points where we started around mental health, and I'm going to jump on stress and say, as a takeaway, one of the things we need to do is to encourage people in our circles to mitigate stress, to manage it better, to avoid it, and to find support systems to better absorb it. Fellowshipping through church and other religious workplaces of worship and such things is critical in these days. And those organizations that need to come together to do some of the other things we talked about. I mentioned how economically and environmentally it's difficult to get good food. But this is where, as a takeaway, we can all work at your local church, your local whatever organization you're in, to find ways to make sure people either can get to farmers markets or farmers markets come into your community. Let's help start more community gardens and the cooking classes that go along with that, and really give people empowerment. It's very easy to say, you figured out you should be healthy or go get the right thing. But what we learn in public health is people do the right thing when doing the right thing is the easiest thing to do. So our job as physicians, leaders, is to try and really create an environment where doing the right thing is the easiest thing to do.
Fantastic. Dr. Batiste?
Wonderful words of wisdom from Dr. Snipes and Dr. Walsh. And all I'll say is, I think each and every one of us has a responsibility to be a part of the solution, not part of the problem. And that's ultimately, we all have a role inside of the future for our communities, right? For our kids and our grandkids and our great grandkids. And that begins right now. So laying the foundation. And so that means words of affirmation. Like Dr. Walsh said, he gave the words of affirmation to the young African-American teenager to affirm him in who he was, that he needs to go ahead and buck what he sees, to push back and say, I'm not who you say I am. I'm greater than this. And I can be a physician. I can be a surgeon. I can be an administrator of a large healthcare organization, right? That it is possible. And I think those words of affirmation and then investing your time and your energy, even if you don't have financial resources, is equally as powerful as anything else. All right. That's
Absolutely. Absolutely. And I just will like to say that, people would rather see a sermon than hear a sermon any day, right? So, just continue to walk the walk, to continue to do your best and be encouraging and live your best life, because as you're doing that, people are watching, right? So it has a huge impact on that. So We want to thank you guys for joining this conversation. Thank you all for being a part of it. Please stay tuned for future episodes. Please visit our YouTube channel, Slave Food. You can go get previous episodes as well. And you will also be getting a schedule of our upcoming talks throughout the course of 2022. So thank you and enjoy the rest of your evening.
Good night, everyone.
Yeah.